Hello, welcome back. The topic today is diabetes and digestion. How diabetes affects our digestive system. We all know diabetes means high blood sugar level. These blood sugar levels basically affects our nervous system and blood vessels. The nerves and blood vessels are affected when the blood sugar rises. That is the basic problem in diabetes. So these nerves and blood vessels are very rich in our digestive system. Our digestive system starts from mouth to anus. It's a 30 feet long tube, and it is under the control of blood vessels and nerves. There's something called peristalsis. Peristalsis is a wave-like motion in the gastrointestinal tract. Starts from the esophagus to the anus. So it's like in a minute, usually 5 to 30 times the intestine contracts. The contraction is like a waveform, and it propels the food, water, whatever the gas, everything down, and we excrete them out. When the nerves and blood vessels are affected, it can affect the peristalsis. That is called gastroparesis. When you have a diabetes uncontrolled, then you can get gastroparesis. Gastroparesis is where the gastric emptying or the emptying or pushing down of the food is affected. So you feel full, you feel, with little amount of food you feel full, bloated, gaseous abdomen. All these things can happen with gastroparesis. The number two, the diabetic diarrhea is one of the most dreaded complication, because it has no treatment for that. So with the gastroparesis, most of the time they will have a constipation, but here they have a diarrhea, kind of osmotic diarrhea, where the treatment is very difficult. The third one is called diabetic neuropathy. The peristalsis, the gut movement, is not under our control. It is autonomous. It is under control of autonomic nervous system. When these are affected, everything is affected. Like the gut motility, the digestion, everything is affected. So they can get a bloated feel, early fullness, constipation, or even diarrhea, loss of appetite, bitter taste, all these things can happen because of the diabetic neuropathy. The other thing is our digestive juices, right from saliva, bile, pancreatic juice, acid, everything is under the control of nerves. So when nerves are affected, these digestive juices or the enzymes are all also be affected. So they can directly affect the digestion. And the gut bacteria, in diabetes, the gut bacteria, there is an imbalance. So the good bacteria, bad bacteria imbalance causes more digestion problems, and sometimes diarrhea or constipation. And so if you have a diabetes, it can affect even the other, from not only the intestine, it can also affect the other systems in the abdomen, like your liver. So fatty liver, diabetes is a metabolic disease, so it can cause fatty liver, non-alcoholic fatty liver. So this can cause again digestive problem or insulin resistance, leading to high blood sugar and other problems. So if you have a diabetes, understand it can affect your digestive system. Most of the people know the cardiovascular system can be affected, kidney can be affected, but your digestive system can also be affected. So consult your doctor, keep your sugar under control, and when your doctor can advise you the do's and don'ts, or what to eat, what not to eat, whatever it is, prevent the complication arising out of the diabetes by your good sugar control. Thank you.